these devices are commercially available. A lot of them are really marketed kind of for sports performance. So the idea was that they were these specific lung training devices that athletes could use to get better, faster, stronger. So the use of them for cardiovascular health is kind of repurposing an existing technology. So there's a bunch of companies out there that make devices that do inspiratory muscle strength training that provide resistance when you inhale. What I recommend people look for is a device that can sort of provide a high level of resistance, because the trade-off when you're doing 30 resisted breaths per day, as I talked about, is those 30 breaths have to be really hard, and some of the devices on the market just aren't up to snuff. They can't give you enough resistance to kind of do the training. So the units for resistance when we talk about respiratory exercise are centimeters of water. And I tell people if you're going to buy a device, make sure it can produce at least 100 centimeters water of resistance. The very cheapest devices aren't going to get close to that. But for probably around $70, $75, you can get a device that is able to go much higher intensity than that and can kind of fulfill the training. The other part of the question is, are they covered by insurance? And not yet. So the data on this intervention really come from a good number of studies now, but they're mostly small clinical trials done, over the period of 1 to 3 months. So it's still kind of ballooning out into those large clinical trials that need to be done before insurance companies will carry it. So that's the goal and where this research is headed, to kind of move it out of the laboratory and into the public health domain, but not yet covered by insurance.